Let's talk about the rib cage. Let me just make sure it doesn't. There we go. Let's talk about just the rib cage real quick and stuff like that. So rib cage is really amazing because it's designed to protect our vital organs. So if you got hit by a speeding bullet down a skiing hill or snowboarding, essentially instead of having this hit your heart, so to speak, you have this nice little cage that stops that. There are, of course, muscles that wrap around. So let's talk about the muscles that wrap around within the lat. If we really just get deep, let's just go all the way deep. Like all the way, all the way, all the way. Like where you're having some pain. Right through like this general region is where you're kind of having that pain. Mm-hmm. We have a lot of the the levator costrorum, which is actually really helps to elevate or levitate or increase that movement. So if you follow like the movement of that, it's going to go up and down, right? It's going to pull this up. So it does this a little bit. Mm-hmm. There are some deeper muscles. Let's get rid of this. Some of these as well. And then there are some of the ones closer. There are multifidi, which are the postural muscles that kind of get fatigued. I'm sure if you stood up like with perfect posture for a long time, you probably are starting to feel fatigued in that area. Mm-hmm. That's usually as a result of these muscles and those long muscles that are just kind of reflected out of there that get really tense and tight and are really responsible for like elongation of your spine. Anybody's going to get tired, but especially after an injury. Mm-hmm. That's going to happen to you. But we also have some of these rotatories in that area, and that allows us to rotate more sort of towards one direction. That's what I think is right. Let's be honest. There's never a single muscle that's involved. But if you talk about the deeper level of muscles that I think are really involved, these are it. A lot of time people will have the nerves that are getting irritated. So if you find like one of those nerves that come out, I asked you many times, does it wrap around? You said no numbness, no tingling. Mm-hmm. High five, congratulations. I'm not necessarily worried about the nerve.
Right.
I am maybe a little bit more worried about like the intercostal muscles or the muscles that run in between that get a little irritated in that area. So it makes sense why just maybe you're having a little bit of that pain in the shoulder blade because maybe these muscles are working a little too hard. Maybe now these muscles right around this shoulder or scapular blade are working a little too hard. I did a lot of compression tests. I kind of like did all this crazy awesome stuff to see if it would hurt, like break wise. Mm-hmm. You would have punched me by now,
right?
Or you'd be like, dude, don't ever do that again. Or hey, stop doing that.
Right.
You would have known. There's no bruising, which is great at least at this point in time.
Right.
It is 3 weeks out though,
yeah.
So. The only thing is like when you have I've seen this in like so many cases with like especially with like surfers and jiu-jitsu guys, they hurt their ribs a lot. It's because when you have one area of rib that's hurting, whether it's in the front, if you kind of wrap that around to the back, we kind of have this one thing that wraps around. So when you have a dysfunction in the back, this isn't moving as well. You're going to sometimes feel that rib pain and that cartilage pain through here. You see this more in jiu-jitsu guys and sometimes surfers because they kind of irritate the hell out of the costocartilage. I'm sure you've familiar with that. But you're not necessarily having the front part of it. You're having more of the back as an issue. Mm-hmm. So I think a lot of soft tissue is going to help you. Elongation of that is probably what you want to think about, but not necessarily do right away. Mm-hmm. Because anything that kind of pisses it off, we don't really want to do at this point in time. I think we're going to do a crap ton of soft tissue on you. Okay. I know we are, actually. Mm-hmm. Do you have any questions on that?
No.
So what I'd like to do